My name is Darlene Smith and I live in Chattanooga, Tennessee. I'm also an 18-year breast cancer survivor. When cancer came into my life, it was totally unexpected and I was devastated. I had a late-stage breast cancer diagnosis, and not only was I devastated, but my husband, my children, and all those who knew and loved me were also affected. You know, cancer doesn't just affect the person that has cancer, but it affects everyone that knows them. I met Komen very quickly after my diagnosis when I attended my first Race for the Cure, and boy, that was a fun time. They provided the encouragement and the support that I really needed to get me through a very difficult situation in my life. I soon determined, as I went through the many months of treatment, 19 months to be effect, including surgeries and chemotherapy and radiation, I decided that whatever time I had left, I was going to try to utilize it to help other survivors and their families, and to try to get the best possible care that we possibly could. With Komen, I have had a great time. I have served in many different capacities. I've been the race chair for the Race for the Cure locally. I've been on their board for 7 years here in Chattanooga. I've also been grant chair for 3 years. I've been a speaker on their Speakers Bureau. And currently, one of the things I'm most interested in, I'm a breast cancer advocate. As an advocate, I try to lobby for bills and for laws that will help promote cancer research and help cancer patients and their families receive optimal care so that we can move forward. You see, one of my very best friends was re-diagnosed with breast cancer when she unfortunately experienced a reoccurrence and she lost her battle. My younger sister currently has stage 4 colon cancer, and it rocked my world. We have gone a long ways, but we can't stop the fight. I have the opportunity, I lobby both in Nashville and in DC with our Advocacy Bureau and try to bring forward and be a voice for people that cannot have a voice, so that they know we're not a name, just a number, but we are true people with individual lives and families, and we count and we matter. One of the bills that I was able to participate in lobbying for was recently in DC. Now, it looked a little different this year because we had to do it remotely, but I thoroughly enjoyed it. Due to the Affordable Care Act, most mammograms routinely you can have at 100% coverage because the deductibles and copays are waived. But what happens if something shows up on that mammogram? Many of us have high deductible plans, so the deductible and co-insurance comes into play. Well, unfortunately, many women put off further testing because they can't afford it. So we are asking our legislators to put in effect a new bill that will waive the diagnostic testing after something has shown up on the earlier screening mammograms, so that those can be covered at 100% too. An earlier diagnosis is proven to have a better outcome, less treatment, better results. We've come a long way. And I'm so thankful for the research that has happened and that I'm still here today. But we're still losing too many too young. Your voice matters.